is Caitlin Rivers. I'm with the Network Dynamics and Simulation Science Laboratory. And so Twitter has been used to detect a variety of infectious diseases in advance of traditional methodologies. For example, influenza-like illness has been shown to be detected 2 weeks earlier than traditional public health surveillance. So I'm doing a similar thing, but with risky behaviors associated with the transmission of HIV. So with the subject matter expert, we created a list of words that relate to risky sexual behaviors and intravenous drug use, which are risks for contracting HIV. And we collected tweets that contained one of those keywords and are also geolocated. We started with 500 million tweets, and of those, 10,000 were both geolocated and contained one of our keywords. And we then tallied the number of tweets that came from each county in the United States and compared that to public health data on prevalence of HIV. And what we found is that even when controlling for measures of socioeconomic status, for example, median income, Gini index, and so on, the number of tweets related to HIV that came from each county is still correlated with HIV prevalence. This is useful for a number of reasons. First of all, it really helps to target interventions so we can tell what communities these tweets are coming from, and those would be good places to deploy public health interventions. And it also allows for possible detection of changes in prevalence. So if we can detect that the number of tweets in a county is changing, then we can say perhaps that there's something going on there, that more HIV is occurring or more risky behaviors are occurring, and we should deploy more interventions. I'll take questions.
So do people that tweet realize that you guys are just pouring over their private stuff?
It's not clear. It clearly says in the privacy policy that there is an API that allows anyone and everyone to access tweets in enormous numbers. And the API does exclude people who have their privacy settings turned on, but beyond that it's not really clear how much people are aware that their data are being collected. And yes, people do tweet about these things.
So what are some of the keywords?
Yeah.
A lot of them are things that were culled from Urban Dictionary, so they're not necessarily repeatable, but they pertain to risky sexual behaviors and intravenous drug use, so things like heroin, cocaine, sex, a number of keywords related to men who have sex with men. Yes?
Bad timing of the question. So, with respect to your data collection, this map that you have here, I presume that's from your data or close
Yeah.
by. So, do like Vermont and Massachusetts have certain laws that, I mean, they have data. They don't have data in the picture, but
Right.
people are tweeting.
The gray is a mix of missing data. So some of the counties, we collected no tweets, so there's nothing to display. But for certain states where the entire state is blacked out, it's because they don't release their HIV prevalence data. So the Dakotas, Vermont, Massachusetts, Delaware, I think Maryland, they don't release data.
Okay.